Hey everyone, welcome back to my channel, and if this is your first time coming to my channel, please make sure to like, subscribe, and hit the notification bell so you can get updates on your latest travel nursing news or your latest yoga classes. Today I am going to be giving you pros and cons of travel nursing. So we all have our opinions and some people have questions, but I want to give you the pros and cons of travel nursing, so stay tuned. Hey everybody, all right, welcome back. So yes, let's get into it. So I'm going to start with a few pros. So with travel nursing, I know everyone, the first thing that comes to mind is people talk about money. So yes, the money is definitely a pro. So when you are a travel nurse, depending on where you're working and just in general, usually you can double or even triple your salary. So I have, in my journey, tripled my salary as a travel nurse, which has been really, really nice. And it allows you to save money. It allows you to, pay off debt and, be able to travel and just do some of the things that you really want to do. So that is definitely a pro for me. The money is always really, really nice. So yes, being smart about how you do your travel assignments, how you save your money, how you spend your money can definitely just be a benefit of travel nursing and just, making the money that you make. Next, let's talk breaks and vacationing and being able to live the life that you want to live. So travel nursing allows you the opportunity to travel, take time off, and just move at your leisure. So you can pick an assignment somewhere that you've always wanted to go, like Las Vegas or within the United States, of course, Texas, Florida, Vermont, Boston, Philly, of course, California. Yes, travel nursing affords you the opportunity to just take time off. So in between your contracts. So, some nurses I know, they take 2-3 months off in between their contracts. It depending on what your bills and what your money looks like and how much money you save and what your spending habits are. But it allows you to take long breaks. And if you've watched any of my other information videos, it'll, talk about how to take the breaks that you want to take and work as a travel nurse. I like to take off a month in between contracts. I will be taking off at least a month after this contract, especially with all this COVID stuff going on. It'll give me some time to digress. But generally, you can take that time off. You can go travel for a month. You can go live abroad. You can do whatever you want. Also, I look at it as like this. If I always wanted to visit a place like San Diego or a place like Las Vegas or a place like Dallas or Houston, Texas or Miami, Florida, why not take an assignment there? You get to live there for 3 months and make nice money. So, you have to think about it like that. You can take long breaks, you can travel, and you get to see the entire country. And honestly, there are travel nurse agencies that you can join or, work with that you can travel out of the country. So, think about it like that. There are lots of opportunities. You can work in Dubai, anywhere. All right, so pro number 3, right? You can use that long time or those breaks, and you can use that opportunity to grow your business, grow your brand. I know a lot of nurses who are actually entrepreneurs. I know a lot of people in general who have their full-time job that they may have gone to school for, but then they also have their side business. So this allows you as a travel nurse to take time off and really focus on branding and building your brand and networking. I think networking is a great opportunity when it comes to travel nursing because you're meeting people all over the world, or all over the country, I should say. You're meeting people from all over the country, and you have the opportunity to just really network, get to know people, meet and find people that are in your branding network, and really just expand and grow and really just get to meet people. I think that's a great way of networking, is being a travel nurse and being able to be all over the place. Now with pro number 4. So travel nursing provides you a new experience, new opportunity, not only again to build your brand and build your network, but it also gives you the opportunity to diversify your profile as a registered nurse. So when you pick your assignments, you find hospitals, they ask you which unit you want to be in. Usually you have to go with what your specialty is. Because I am a critical care nurse, I can go to neuro ICU, surgical ICU, medical ICU, CV ICU, cardiovascular. Like, I can go to all different types of ICUs or intensive care units. This, it can be nerve-wracking, but at the same time, because you generally know how to be a nurse, you learn so much being a travel nurse. You see things that you may have never seen in your hospital, especially if you're used to working in like a small community hospital and now you go into a teaching institution. You really learn how to diversify yourself and grow as a nurse. You learn so much more. So I think that is definitely a pro when it comes to being able, pro to doing travel nursing. All right, next, let's get into these cons. All right, so I won't say they're bad things or cons, but sometimes, being a travel nurse, it sucks to have to move every 3 months, or it sucks, having to just move every year, just depending on where you are. Sometimes that can kind of mess with your psyche a little bit. Also, you do kind of have a sense of loneliness sometimes, especially if you don't get to get out and you don't meet anyone, or you're in a new environment, you don't have any friends, you don't have anybody you know or anybody to talk to. So it can be stressful when it comes to that, and sometimes it can cause you to be a little bit lonely. See, I travel with my dog and I'm the only child, so I'm kind of used to being by myself, but I still do get lonely sometimes, and I do miss my family, and just being so far away from them, it does kind of draw and pull on your heartstrings just a little bit. So yeah, I would say that would be a con. Just being away from your family, missing your family, and just having that sense of loneliness, not having friends, not knowing where you are, not really knowing your environment. But a pro to that is you get to really know yourself being by yourself. And I think that's always important, to really know who you are and understand how you feel, understand what you like, what you don't like. I think these are all important aspects of being alone. So it also sucks when you are in the middle of a quarantine and you're in the middle of a pandemic and everything is closed. So you can't even get out to really meet people. You can't date if you wanted to, if that was something that you were interested in doing, because you don't trust that person you meet doesn't have coronavirus. So I would say this, yes, it can be a little bit trying, but I know you can do it and you can get past it and you will grow from it. Really, that's the most important part of it. Next, another con. So when you are, starting at a new hospital, of course, you have other nurses who've known each other. They've been working with each other for years. Sometimes people can be a little bit cliquey depending on where you are. So just, that can be a con in itself. Me, I come to work and I don't really get involved in all of that, the shenanigans and the gossip and all that stuff. I stay far away from it. But that can be a con of being a travel nurse, is being around people in general who are cliquey, and they may want to help you, they may not want to help you, they want to give you the worst assignment. I don't want to say the worst assignment, but they may not give you the most challenging assignment, but they will give you the most difficult assignment. So you'll get that patient who keeps pulling and keeps trying to climb out the bed all day, who may not be as sick as somebody on a million pressors, but that's that difficult patient that nobody else wants to take. So you'll get that assignment. That's what I mean. That's a con of being a travel nurse. Now, it doesn't happen everywhere, but that could be something that you encounter when you are a travel nurse. And sometimes they talk about nurses eat their young, or, staff nurses tend to not like travel nurses because we make a little bit more money than what they're making. You run into that too, but I haven't had too many issues on my travel assignment. So yes, I want to thank you all for joining me today. Those are just a few pros and cons of being a travel nurse. Feel free again to like, comment, subscribe. Drop a comment below. I want to know how you feel about these videos. I want to know if there's any other content that you would like me to deliver to you. If you have any questions for me, I'll be happy to answer them. at any time. All right. So with that being said, I hope you have an amazing rest of your day, and I will talk to you soon. Peace out, y'all.